All. This is Dr. Mubin Sayed from DrBeen.com. Welcome to the KoolBeens Cafe. So this is the place where we do our chit chat, and I wanted to show you. This is our channel. So you are live on this channel. Some of us are here as well. Now I see some questions about these reports. So let me see if I can answer some of them. There is the first one. Crystal says, so could children be losing their herd immunity due to lockdown and mask wearing, no longer exchanging common bacteria and viruses? So I don't think that they are losing herd immunity, because that would imply that they have acquired the immunity. So those children, if you see, the ages are younger here. So these are probably the children who have been just born during the pandemic or before, just before, and are just barely out of the pandemic now, and they haven't yet developed enough immunity because of interacting with other children and developing those exposures. So I think instead of actually losing the herd immunity, they haven't developed the herd immunity against these kind of viruses. So yes, they are, just like we are all, or we were all, uh, prone to getting severe COVID in the beginning. Again, the variant was that type as well, but we were all sitting ducks, if you will, because none of us had any way of fighting with this. We were immunologically naive to that. So it is possible that these children are immunologically naive to adenovirus, or maybe how many more viruses or bacteria we'll see in the coming months and days as children now go back and interact with others. There is a risk. At least that is the hypothesis. I keep saying it so that people don't think I'm just making this thing up. This is the hypothesis from Scotland. This is Scotland's report in Eurovision. And here they say, if you can just search for the word immunological naive, immunologically naive, then you would see that here. So here, at the time of publication, let me actually make it a little bigger. Now I have it lost. Here, at the time of publication, the leading hypothesis. So again, we have to be fair to them. They're saying this is a hypothesis. The leading hypothesis center around adenovirus, either a new variant with a distinct clinical syndrome, meaning just like SARS-CoV-2 is a coronavirus with a distinct syndrome, a different set of symptoms. So with a distinct clinical syndrome, or a routinely circulating variant that is more severely impacting younger children who are immunologically naive. The latter scenario may be the result of restricted social mixing during the COVID-19 pandemic. So again, they said maybe. So um, that means it's not yet fully clear. However, they have seen adenoviruses to be positive. And if you look at Alabama's report, and just to, for the be quick, if I just look at adenovirus investigations. So I'm reading the title now. Investigation of 9 young children with adenovirus are underway. That's one. Then it says, and this is alabamapublichealth.gov. This is an official site. Then they say here, if you see symptoms of gastrointestinal illness. Let me make it bigger. Actually, okay, so symptoms of a GIT illness and varying degree of liver injury, including liver failure. Later analyses have revealed a possible association, of this hepatitis with adenovirus 41. So they have gone, instead of saying a hypothesis, they're saying maybe there's a possible association. And so that, if you continue, to date, 9 children less than 10 years old have been identified as positive for adenovirus, and 2 have required liver transplant. So Alabama is a little more kind of associating or linking them. So that is the, hopefully that answers that, Crystal. Let's see. I saw some more questions as well. So meanwhile, in America says, is it not unusual that this mystery adenovirus is not circulating among vaccinated portion of the population? So again, the basic idea, these children are younger, 5 years, majority of them, especially Scotland and UK, 5 years and younger, and they actually are not allowed to have vaccines. Number one. Number two, they may be more immune naive compared to more older children who may have had a chance to develop immunity against adenovirus in their previous exposures to each other. So it may be not some some negative thing, but it may actually just be children's exposure. Negative in terms of some vaccination, not vaccination kind of a situation. It is still negative. Children are requiring liver transplants, and that's a huge problem. So, meat in my teeth says, I've had amazing success almost overnight treating my long haul with MCAS protocol. All I have left is tachycardia. Does that take longer to go away? How long cannot that? Thank you enough. So, number one, you're welcome. Number two, yes, tachycardia goes away as well. If we listen to Dr. Keith Berkowitz, he usually restores the fluid levels and believes that that helps with the tachycardia plus vitamin C. In the other patients who did not receive this part of the protocol, I have seen that their tachycardia over a few months goes away as well, and it starts settling down. That's my observation. So this is a good question. What are the 3 to 5 best foods kids could be eating now and 3 to 5 worst foods? It's not about the best or worst food. It's about the possibility of contamination or not. So those foods where it is possible that there is hepatitis contamination or adenovirus contamination, and that's not a food group, but really the handling of the food, these would create an exposure. So generally in terms of best foods, foods that are rich in vitamins, especially vitamin D, calcium, they are important. Milk fortified with vitamin D is important. Then foods that would allow children to have more of the fish oil or uh, anti-inflammatory reactive oxygen, so vitamin E's and vitamin C's and vitamin D, these will be very useful. And for liver, some sweet things help the liver a lot. So can viral vector adenovirus shed from vaccinated like the live attenuated flu vaccine? At least in theory, not, because the vector is given here. So from there, all the way for a viable virus to reach the throat, infect this area, and then cause cough, then shed, doesn't seem possible, but we can wait more. Ashley says, I've reactivated EBV since getting the vaccine, which I never had before. Any advice on how to suppress it again? Excuse me. So the check out the I recover protocol. Many parts of that actually help with this situation as well. But again, EBV have its own separate management, plus hopefully the keeping the stress level down would also help. Les Smith says, could it be that these children's immune system are generally naive rather than specifically naive to the that's correct. If they are not interacting with other children for majority of their life, that is younger children, then it is possible that they will have naive immune system to many of the pathogens. So Cynthia says, may have missed this earlier. Their hepatitis is community acquired. They don't know yet. So they're thinking that maybe they're exposed to someone else with hepatitis or with adenovirus, but they're not sure. Of course, for example, in Alabama, 9 out of 10 had the adenovirus. So they have adenovirus, but is this the adenovirus caused um, inflammation? They do not know. Or is this something else they do not know yet? That is why they're calling it unexplained etiology. So, Mel, this is a good question. I try, especially in case of children, I try to avoid the discussion. I don't feel that I am qualified or specialist in that area to be able to offer an advice. I would repeat what Scotland is saying, and that is maybe during the um, here, maybe during the sheltering time, their immune system stayed naive. Rima says your cough doesn't sound good. So much better than before, but still there. So I spoke with my doctor today. He has prescribed me a few things. We'll see. He thought these are allergies plus maybe post nasal drip. So I don't feel that there is a post nasal drip, but allergies I can agree with. Sue says can't see screen blurry is focus off. So sometimes if your bandwidth, network bandwidth not is fluctuating, then it is possible just your video becomes blurry. And if my network bandwidth is fluctuating, then the video will become blurry for everyone. Texas is Luffy's slobber allergy. Yeah. So Meeple Art says liver transplant is extreme. Yes, that's correct. Was there nothing they could do to prevent its progress? No. So in some children, no, and that's why they ended up with the liver transplant. Sometimes fulminant hepatic failure is a very devastating and rapidly progressing disease. Kelly, yes. So my doctor and I thought these are allergies. He had some other ideas as well. For example, post nasal drip, or he asked me if I had, um, reflux from my stomach as well. And I think I had reflux maybe a couple of times, and that is just because my eating habits changed with the fasting. Otherwise, not. But he wanted to kind of attack all of these things. So he gave me medicines to reduce the reflux and to help with the allergies and inflammations and so on. So we'll see. I'll go pick up the medicines tomorrow. Lennon says, "What is the best medical film you ever seen?" Medical film? I can tell you um, what had. So this is a story time. What medical film made me totally amazed and shocked and surprised? And that is, and I'm not kidding you when I'm telling you this. In our culture, it is actually sexual knowledge in the early years is not very common. We don't have sex ed, and we don't talk about sex in the early ages. So when we started the first year medical college, so what should be my age at that time? 10th grade is 16 years, then 2 years, what we call FSC, so 12, so 18, one more year, 19. When I was in the medical college first year, our community medicine team, when they were teaching, they showed us the safe sex practices. They taught us for uh, community help or for the people who wanted to uh, practice these, uh, you wanted to use these instruments. And I was, for the first time in my life, I saw, so they had illustrated videos. And for the first time in my life, I saw the use of condom or others. And this is, I'm talking about 1989, 90, if I graduated in 90, somewhere in those years. And I still, to this date, cannot forget my amazement for seeing such a video for the first time. I was totally naive. So Lori says that get a Navage machine. Okay, will do. Will do. Otherwise, for me, the fascinating parts of the medical videos are a couple of videos that have really, really been interesting for me, which are other than this early part of my life video. One video where the macrophage is eating the pathogen. So let me actually see if I can show it to you right now. That video had really made me so amazed. Macrophage chasing bacteria. This one, let me see if I can turn the audio off. So this is a macrophage that is running after these pathogens, and it's going to then engulf them. This is what we talk about almost on daily basis. Macrophage has receptors, tall-like receptors. It knows that the pathogen is there, and it just phagocytosed it. Now that is the pathogen is in a vesicle. This vesicle in which the pathogen is, let me back up a little more. This little vesicle in which the pathogen is, macrophage would then connect a lysosome with it and kind of destroy it and break it. So this is very interesting for me. I saw for the first time macrophage chasing a pathogen and eating it up. Look, this is, and look at how our cells are not just, look at this phagocytosis just occurred. Beautiful. And then the other one that I really love is um, the micro microtubule and dynein, inosine and dynein motors. So this one, I love this. I hope I can look at this. So, excuse me. Remember that I talk about our cells are not really just bag of water. They actually have highways in them, and they have um, little vehicles that carry substances from one place to another. This is what you're seeing. This little tube is a microtubule. And interestingly, for the cell, the microtubule is formed on the go. So once we know that this substance need to be moved from place A to place B inside the cell, microtubular structure may be formed at that time. There are some structural structures that are always there, but new new highways are formed. Then this substance that need to be carried is connected to this little motor, or imagine this little car, and then that car walks on this microtubule to go from place A to place B. Then this microtubule is dismantled. So check this out. Can you see how these kinesins, kinesin from kinetics or motion, how these kinesins then pick up the, and it's somebody's copywritten material. So that is something that is really interesting for me. And then the activity of the brain cells is very interesting as well. So there is so much that is interesting, but these things just cause a lot of fascination for me. So Dan Ban says, Dan Ban fan, can you talk about AvioShell? Yes, I have actually that on my list. And here we are. First the ADE, then the exosome, now this hepatitis. I had to talk about Medicago and many other such things. So we'll do. And says, I love the science fiction inside our bodies. Absolutely. Every cell is a universe. Our big whip says, I am wondering about exosome circulating in the blood, body. Are the exosomes carrying the full spike protein or just the S2 part? If it's just the S2 part, wouldn't that be a lot safer? Very good question. And excuse me, I'm so sorry for this. If you remember the paper that I discussed, in one part of the paper they said S2. So let me actually open it. Give me 1 second. I hope I can find the correct one. Okay, so 1 quick second. My apologies. I'll have to um, find the paper. For me, that was curious that the, if I bring it here and then share my screen. So it was curious for me that, for example, here they said cutting edge. circulating exosome with COVID spike protein are induced by Pfizer BioNTech vaccine. So, right in the title, they say COVID spike protein. For the majority of the time in this article, they actually discuss spike protein on exosome, but in one place, they actually say S2. Here, if you see, they say circulating exosomes isolated from vaccinated individuals contained SARS-CoV-2 spike protein antigen S2. And then here the results demonstrated the presence of SARS-CoV-2 spike antigen S2 on exosome at day 14 of dose 1. So that is what they said only in this place. If you see, there is no other S2 discussion here. Circulating exosome, same exosome isolated from vaccinated healthy individuals contained SARS-CoV-2 spike. We analyzed this, and but then they have Western blot of exosome with the spike protein S2, spike protein S2 in exosome. Then in the majority of the discussion, look at this: spike protein, spike protein, spike protein, spike protein, spike protein. So either they just used the word spike protein to kind of imply S2, and they thought that in that one paragraph where they discuss the S2 part, maybe they imply that once you read that, you can then retrofit your understanding that this is S2. So I was confused. Ideally, we should reach out to the corresponding author and say, was it a complete spike or just the S2? And you're right, the implications are different if it is S2 versus the whole spike. If you ask me, my conjecture will be, my hypothesis will be, there will be some spikes and a lot of pieces, because this exosome is getting built from the endosomal antigen structures, or the antigens that are being shredded in the endosome. So majority of them would have been broken down. Some of them would still be complete and got plopped on the exosome. Just my theory. So Anne says, how many people were writing that paper? And which one? This paper? This is Sandhya Bansal, Sudhir, Timothy, Kristen, Brian, Ross, and Thela Color. We can probably see. So if we go to the top of this, so here, Sandhya Bansal, Norton Thoracic Institute, St. Joseph's Hospital and Medical Center. Sudhir, Medicine, Yale School of Medicine. So he's from Department of Pathology. Timothy, St. Joseph Hospital. Norton Thoracic, Kristen, Norton Thoracic Institute, St. Joseph. Brian, St. Joseph. Ross, St. Joseph. And Thela Kalur, St. Joseph. So there's one person, I believe, who's from Yale here, and he's from the pathology department. So that is the, if you were asking Anne about this paper. Hey, Jody, how are you? Kyron says, how many doctors knows that IV vitamin C? Don't know. I, of course, looks like a rhetorical question. I have no idea. 3 amigos say, Children are long locked down indoors, lack healthy exposure to vitamin D3 from sunlight. Can this cause virus or bad bacteria, diarrhea? Can vitamin K2 from broth help restore healthy stomach? So, vitamin D3 or vitamin D's deficiency definitely has its own s- problems, including reduced management of successful infection control and so on. I've done complete discussions about it. Can vitamin K2 from bone broth help restore healthy stomach? Not just that, that alone is not sufficient, but it is important for generally to have with if vitamins are being given. Here it says, I worry that the hepatitis is caused by spike from SARS-CoV-2 exposure. Delayed to 3 months, that will be very long. So there is 11-day, the same day, and 3 months. So Nipa says, what about excess use of sanitizer? It's alcohol. Excess use of sanitizer to kill the pathogens and reduce the exposure, Nipa? If that is the case, yes, of course. Last pandemic, we tried to be as clean as possible, which reduced the exposure. Colombian Coffee Bean says, does this mean that vaccine mRNA is still active after 4 months or exosomes are not being cleared effectively? So if I look at this, this is a very good question, and I have the same question as well. There are certain gaps in this paper or lack of clarity. So if I go in here and go to, I hope, for exosome with spike protein, antibodies to SARS-CoV-2 spike, and T cells secreting interferon gamma and tumor necrosis factor increased following the booster dose. So second second dose. Transmission electron microscopy of exosome also demonstrated spike protein antigens on their surface. Exosome with spike protein and antibodies decreased in parallel after 4 months. This is what they write. These results demonstrate an important role of circulating exosomes with spike protein for effective immunization following mRNA based vaccines. Now, they in their diagrams they actually show the level changes. So here, excuse me, so SARS-CoV-2 spike proteins, this is the diagram A. And if you see here, day 0, day 7, day 14, this is after the dose 1 and not much. Then dose day 14 after dose 2, here are the levels. And then 4 months later, here are the levels. So it kind of went up from nothing to up and then went down. And this is kind of quite a lot of waning. And so this is the spike protein. Then this is SARS-CoV-2 spike S2. So now, did they have spike and S2 both observed, which I thought would have been the case because in the endosome, you have a whole spike protein, which is then being shredded. Some of those proteins can hop on the exosome, all of it. So maybe they had both. But the paper is written in a way that it is kind of not very clear. Then this is the antibodies in the plasma. So this is dose 1, day 14. This is dose 2, day 14, if you see here. And they kept calling it booster, which technically is correct because a vaccine's next dose is a booster. But we have been used to calling them primary series or second dose instead of booster. For us, the booster comes after the primary series. But here, if you look at the diagram, this is the dose 2, 14 days after. And if you see here, this is 4 months later. So it went on from here to here and then down. And that is what you see here in the exosomes as well. So hope that offers some clarification. T. Oliver says, Beano fans are the smart peeps on earth. We are actually very well versed with the mechanisms. I don't think any other channel's audience is so well versed with the mechanisms. And that allows us free thinking as well. Maureen, I don't think that the alcohol on hand is sufficient to cause hepatitis. Kevin says the ultimate question is why so many people have absolutely no outward reaction to SARS-CoV-2 infection I do not know the definition of outward reaction. So can you give me a little more? So has this even happened or been seen before? So that's what they said in Scotland's report. They said in Scotland, in children, hepatitis of unexplained nature is about under 4 cases a year. So they do see it, but less. And now within these 2-3 months or within 3 weeks' time, they saw 5 cases. So of course, it's not going to be just hepatitis occurred out of the thin air. There is going to be some reason. And Scotland had a more closer hypothesis. Alabama has a more closer, more confident words that it is associated with adenovirus. So that's how they are looking at it. So Johanna says, can you please give me the website that shows the phagocytosis? My screen is too blurry to pick that up. Johanna, all I did was I went to YouTube and I wrote macrophage. I'm going to write it here. Macrophage. I'm going to write it in the comment. Macrophage phagocytosis or macrophage chasing a bacteria. That is what I wrote, and then it comes up. You're correct, Ashley. This is, of course, a serious thing. I hope children stay safe. Meeple Art says, do you think one person traveled super spreading a certain virus? If it was due to COVID exposure weakening kids, surely we would see even more cases in more places. Maybe it was one person starting from Scotland, UK, or UK to Scotland to here. Maybe. That's an interesting theory as well. SK says the 4 months level 4-month levels are similar to the 14 days level. So if I go in here, this is 4-month levels. This is 14 days levels. This is 4 months level, 14 days levels. Then here, this is 4 months. This is 14 days after the second dose. This is 14 days after the first dose. And this is 4 months. This is 14 days after the second dose. This is 14 days before, after the first dose. So Anne says, were they in a cluster geographically? So Alabama said that they were from all over the state. So if I go to Alabama, where are the, if I go here to Alabama, they said these children presented to providers in different areas of Alabama with the symptoms of GIT. So, excuse me, they also say the affected children were from throughout the state of Alabama, and an epidemiological linkage among them has not been determined. None of these children has had any underlying health conditions of note. So at least Alabama said that no. Robert says on YouTube, killer T cell destroys ovarian cancer cell. Let's see that too. Look at that. Very interesting. So this was the killer cell. So T cells create holes in the cell and then throw granzymes in them. So the cell actually doesn't stand a chance, because if you punch a hole, again, this somebody's copyrighted material, I think. If you punch a hole in a cell, that cell is not going to live. Yes. The bacteria escaping from macrophage appear to have awareness in its motion, and the macrophage had the awareness as well where the pathogen was going, because macrophage has those little microscopic um, thaw-like receptors, so they can keep honing in, just like Roomba can know when to stop. Macrophages have those all over them, so wherever pathogen is going, they'll start drifting to that side. And can you imagine how these macrophages, they're running around so fast? Do you know how they run like that? They have, let's say, this, if you look at my hands, let's say this is a pathogen. Inside the pathogen, there is a structure, which is the microtubules. And then what happens is, whichever direction the cell wants to move, that direction will make new microtubules, and we would dismantle them from the other direction and keep doing that, and the cell would move in that direction. This is like, if we have to move that way, imagine our bones keep getting removed from the leg and more towards the head side, and then more towards the head side, and we move that way. So with all that kind of assembly of adding microtubules and removing microtubules, the macrophage was still running around. Although this must be a sped up video, it won't be this fast, but still it's fascinating. So I heard Vanilla Bean has a good question. So where is the question? John 63 says, new microphone, your audio sounds good. Yes. So this is a Shure SMB7, something like that, with a Go XLR audio interface, because my other mic was, it actually broke. So I had to buy a new one. And so I thought I should buy a more professional mic. Thank you for liking the mic. So meanwhile says maybe it's an unusual variant. So they said that. They said it may have been it altogether a new variant of some virus, a new virus, or a new variant of adenovirus, or the same adenovirus. Robin says a new mic is great. Thank you. Meanwhile, in America says previous study they gave exosome to mice. I wondered, could pure exosome be milder than an mRNA vaccine? And if so, would that be easier on our bodies in terms of reducing excess inflammation? Maybe, because exosome is made up of our cell membrane particle, and the lipid nanoparticle may be a different structure. The problem only is going to be, well, that exosome can act like a Novavax type product. What I do not know is, do they need adjuvants with it? But it's a good idea. So our big whip says, how concerned should we be about the exosome paper results? So I'll tell you how I see it medically. And when I say this thing, then I disappoint some of the folks who are using these kind of studies to kind of disappoint others or scare others or make them nervous. These exosomes, if they're being made with the vaccine, they will be made by the virus as well. Number one. Number two, you have, excuse me, you have billions of doses given. If the exosome and the ADE associated with, exosome was bad, then billions of people would have that problem. And so we have to pitch it against the clinical outcomes as well. Now, are vaccines totally good? No, you are seeing that the vaccines can cause side effects as well, and sometimes severe, and can cause death or disability, right? So allergic reactions can lead to death. Myocarditis can, if not taken care of in time, can cause death. Disabilities of various symptoms, neurological symptoms, etc., can happen. However, the this exosome seems to be, if this is a repeatable, reliably reproducible paper, and if it means that messenger RNA vaccines always make these exosomes with spike proteins, then you have to pitch it against the clinical outcomes in other people. And that is how you see it. What I see is, sometimes I'm seeing folks who just so tunnel visioned on saying vaccines are bad that they take all of these things to say they're bad. And those who are so tunnel visioned to say vaccines are always good, they kind of, for example, this paper is actually not against the vaccines. This paper is about a unique mechanism of how vaccine train our immune system. So that balance is not there. And the result of that is that the actual vaccines side effects are buried under this whole crazy theories. And so it becomes difficult to separate what is a reality and what is not. And then it is easier for the pro vaccine administrations to just dismiss all such folks by saying, well, these guys are just coming up with conspiracy theories. That is, I think eventually we will reach to the truth with these kind of disputational dialogues. But there are some that are too on one side versus too much on the other side. So, Ashley, this is a good question. Is long COVID just similar to EBV in the sense it's likely going to stay with people on and off for life like EBV does? So, I see a lot of people having relapses, and then slowly those relapses reduce. For example, I was speaking with one of the family members, and now she is 5 6 months away from um, her side effects she had. And I called her, and she said, I am 99%. So she didn't say 100%, but she said, I'm very happy. I'm doing my activities. I'm fine. I'm having fun. And so even then, I noticed that she didn't say 100%. So that means that there is something there. And as more time passes, we'll see that how does it actually pan out. Melamorph says, are there any studies for Omicron blood clotting association? Was Omicron included in the aspirin study you covered recently? What are the people suffering from if ending up in hospital with Omicron? Similar pathogenesis. This study did not include Omicron, it was before Omicron, but Omicron is also still causing similar pathogenesis. It has a different symptom set, but the acute and the severe cases are similarly presenting. Guy Telfer says, can a nephron break away and become a cell or something similar to forming and incubating RBCs, then moving it to marrow like a triumbilical arteriole and venous? Not at all. So let me just very quickly explain it. So here, let's say I should share my screen. So a nephron in the kidney, I'm just going to make one nephron. Nephron has this Bowman's capsule, correct? In this capsule, there is an efferent arteriole that bring in blood in the form of and it breaks down into multiple capillaries. Then there is an efferent arteriole, and I remember efferent as arrival, efferent as ejecting. So efferent brings the blood into the tissue, efferent takes the blood away. Now then there is this convoluted part, then there is a descending limb of loop of Henle, ascending limb, loop of Henle, hairpin turn, then distal convoluted tubule, and then collecting duct. Now, all of these structures, these structures have actually thousands and millions of cells in them. So if the question becomes that can one nephron break down and become a cell, then the nephron is actually a collection of cells. So this would be equal to asking, can a finger become a cell? No, because finger has multiple structures in it and it is made up of tons of cells. So then the remaining is actually not possible. Three Amigos says, does mRNA protein, spike protein, change, remove the immune system's natural barrier? And does it alter DNA genes with CRISPR? Please get a good night's sleep, wrap the throat. We love your expertise. So no, it does not change or remove the immune system's natural barrier or innate, not at all. Does it alter DNA genes with CRISPR? Not at all. Number one, it doesn't have the CRISPR technology. And number two, it doesn't alter the genes. There was a study that I shared as well, and that was it becomes the, what was that? Part of the messenger RNA becomes DNA, meaning it is converted into DNA, but the authors never said it gets integrated in the DNA. And I am seeing so many folks who are implying that it gets integrated in the DNA. And that's authors never said it. They did not have that discussion at all. One can just open up the paper and see it instead of making those statements from outside. But people are saying it. You can actually, I can show you if you just go here to YouTube and if you type here um, vaccine integrates DNA, something like that, you would see so many um, videos that would talk about, for example, here, Pfizer vaccine integrates into DNA of human liver cells in vitro. They actually they didn't say it. So, anyways, um, everyone had a take on it. But if you look at the actual paper, they never said it integrates with DNA. So, with this, I think I can beg leave a little earlier so I can rest my throat a little bit. Um, hopefully, you're all. So, there is a Robin says, I think that Kevin Peltier's question was that the ultimate question is figuring out why so many people are asymptomatic when they have COVID 19. Yes. So that's an interesting one. Um, we still, the only clue that I have had was that those folks where the T cell pathway is taken, cytotoxic T cell pathway is taken, they have less symptoms or no symptoms. So it may be something to do with the immune system's leaning toward away from antibodies, so less cytokine storm and less immune reaction. Chiron says, is the thumb a finger? It depends upon whose thumb we are talking about. So with this, thank you very much. Have a good night. Please like, subscribe, and share. And in the description, there are links. You can get access to DrBeen.com. And there is 1,000 videos there, and the price is really low. Or you can use PayPal to support this work, or you can buy me a coffee, or you can become a patron. Thank you very much, and I'll see you tomorrow.